The Wuhan virus is changing strategy. In the first wave, it was a sneak attack. Nobody saw it coming. The second wave was a long and painful siege. There was a lot of suffering. Now this third wave appears to be a blitzkrieg, forceful but short. Let's begin with the numbers in India. In the last 24 hours, more than 190,000 cases were reported. On Tuesday, it was around 170,000. So infections are still rising in India. What about deaths? 442 deaths in the last 24 hours, up from 277 the day before. I know these numbers sound worrying, but there is a silver lining. In fact, there are two silver linings. One, hospitalizations are not shooting up. And two, vaccination is picking up. More than 20 million teenagers have got their first dose. Outside India, the Omicron wave is peaking. Take Britain, for instance. Last week, they were reporting 200,000 cases. Today, 140,000. Something similar happened in South Africa, remember. Mid-December, they were reporting around 30,000 cases a day. Now it's around 5,000. What do these numbers mean? That Omicron is peaking fast. Most experts agree with this assumption. In Mumbai, the daily caseload has been dropping since the 7th of January. In Delhi, authorities expect the same. The health minister says Delhi's cases could start dropping in 2 to 3 days. If true, this is good news. But it's not a license to be careless. India's hospitalizations may be low, but elsewhere things are scary. Like in France, around 22,000 people in France are in hospital with COVID. In America, that number is 135,000 hospitalizations. Experts can debate why India's hospitalization is low, but here's our job, to keep it that way. And to do that, we need vaccines. Most governments have started rolling out boosters. Israel and Chile are giving out a fourth shot. But the World Health Organization has flagged a problem. They say our existing vaccines are not enough. They must be updated. Tad late, don't you think? The whole point of boosters was to beat variants. But the WHO first called it a scandal, and now they say we need updated vaccines. So which is it? This kind of confused messaging from experts is dangerous. It confuses the public. It politicizes the debate around pandemic control. The best example of that is this man, America's top infectious diseases expert, Dr. Anthony Fauci. He was scolding presidents at one point, attending late-night shows. Everywhere he went, he had the same message: mask up, social distance, and together we can beat the virus. Guess what he's saying now? That Omicron will infect just about everybody. His words, just about everybody. Dr. Fauci says America is on the verge of living with COVID. Why has the doctor turned fatalist all of a sudden? Perhaps he's putting livelihood over lives. Or maybe he's just tired of all the politicization. On that, you cannot blame him. Anthony Fauci has spent the last day answering American conspiracies. Did aliens bring COVID, they asked. Does bleach kill the virus? And on Tuesday, he finally lost his cool during a congressional hearing. Listen to this.
As the highest paid employee in the entire federal government, yes or no, would you be willing to submit to Congress?
I don't understand why you're asking me that question. My financial disclosure is public knowledge.
I cannot find them. Our office cannot find them. Where would they be if they're public knowledge? Where?
It is totally accessible to you if you want it.
For the publip. Is it accessible to the public?
To the public.
Great. We look forward
You
to
are
reviewing.
totally incorrect. What a moron. Jesus Christ.
And it's not just Fauci, by the way. Most Western nations are doing the same thing. They're moving on from COVID. They're moving on from shorter quarantines, no testing, no restrictions. It's like they're shifting the goalpost. In Germany, Italy and Spain, children are being sent back to school. In Britain, airports want testing to be cancelled. Heathrow says they had 600,000 cancellations in December. They don't want to lose any more business. So pretty soon you could fly to London without a test. Just one condition: you must be vaccinated. In Spain, the Prime Minister has surrendered the fight. He says we must treat COVID like the flu. Learn to live with it. Why is the West giving up? For two reasons. Number one, to protect their economy. Omicron may or may not be mild, but the impact it'll have on the economy will be severe, could be severe. So the West wants to protect its precious economic recovery. Reason number two, because they can afford it. European governments are betting everything on vaccines. They're punishing unvaccinated people, hoping it will urge everyone to take a jab. The West has the money for this. to offer a third or a fourth jab. But what about the rest of the world? Not every country can afford to live with COVID. They don't have the health infrastructure or the money to buy vaccines. As always, the West does not care. They're concerned about protecting their lifestyle. In 2020, they came up with unscientific flight bans. The world followed. Last year, they came up with boosters. Again, the world followed. But it's about time we face the reality. The West does not have a global strategy. Their plan has only two objectives: to save their people and to boost their economy. And just to be clear, living with COVID is not an option yet. You can loosen restrictions, you can shorten quarantines, but treating this like a flu is a bit of a stretch.
Endemicity assumes that, first of all, there's stable circulation of the virus at predictable levels, and potentially known and predictable waves of epidemic transmission. But what we're seeing at the moment coming into 2022 is nowhere near that.
If only the West looked at their own packed hospitals. At this rate, around 50% of all people in Europe could be infected. 50%, that's what the WHO says. But why look inward when you can blame other countries? That's what the New York Times is doing. This is their latest article. In India, mask wearing is down even as case numbers rise. Sweeping statement. On the basis of what? One quote and two anecdotes. I'm not even joking. The New York Times just accused a country of 1.3 billion people, and their proof is this: one quote and an anecdote. It is pathetic, frankly. Here's a much better story they could have done. Vaccine hesitancy in America. They'll find better proof for this. 21% Americans are reportedly vaccine hesitant. 1 million Americans are getting infected every day. 130,000 of them are in hospital. But no, their big story is a loose mask in India. We may or may not be living with COVID, but we are definitely living with COVID hypocrisy. WION is now available in your country. Download the app now and get all the news on the move.